When anybody asks me what is dementia, I always start off by saying what dementia is not. Dementia is not a disease, it's not an illness, it's the result of having a disease or illness. The most common cause of dementia is Alzheimer's disease. That's a disease of the brain that destroys brain cells over a number of years. It's irreversible and it's untreatable. It accounts for maybe about 2/3 of all dementia amongst people who are ages, so over about the age of 70. People in middle age who also can live with dementia, about 1/3 of those people are living with Alzheimer's disease as the cause of their dementia. The other major causes are vascular dementia, that is many tiny strokes, again causing the brain to be irreparably damaged. And then there's a disease called Lewy body disease, destroying brain cells but also giving rise to signs that are similar to Parkinson's disease, as well as a vulnerability to falls and a mental illness picture of psychosis, so a person has hallucinations and delusions. So these diseases, those major three, accounting for nearly 95% of all dementia in old age, are the reasons why somebody is living with dementia. So dementia is the result of having these untreatable brain diseases. And so when we're using that term dementia, we're really using it as shorthand to explain the consequences of living with these diseases. So dementia is, in one word, describing the loss of memory, the loss of language, the loss of the ability to reason and think, loss of understanding, perception, recognition. In other words, it's a devastation of people's intellectual world. So in many ways what you can say is dementia is an intellectual disability. And as that person is more intellectually disabled, they become dependent upon other people until eventually a person can do nothing for themselves. The basic everyday tasks of life are just beyond them. So ultimately that person will need assistance with washing and bathing, eating, dressing, and a point will be reached when they will be totally dependent because they will have lost even the ability to walk, and ultimately, if their life is long enough, they will lose the ability to swallow. So diseases of the brain, which are untreatable, cause a progressive dementia that can last for many, many years. It's very difficult to actually say how long somebody lives with dementia. It can be the case that someone can be living for 4, 5 years before a diagnosis is made. And after that diagnosis, and of course it depends on the age or the health of somebody, life expectancy can range from between 2 to 10 years, and some people are even living closer to 15 years. And of course the longer you live with the diseases that cause dementia, obviously the more profound your intellectual disability will become, and obviously your dependency will become so much greater. So what I've not mentioned are words such as wandering and aggression and screaming and shouting and just disruptive, maybe bizarre and unpleasant behaviours, because those are not, in the main, because of somebody's dementia. There are rare dementias, one which is called Pick's disease, that actually does cause people to become disinhibited and impulsive, but the majority just cause that devastation of intellect. So when somebody who's living with dementia, affected by that intellectual disability, wanders and screams and pushes away their carer, that isn't because they have dementia, it's because they're living with dementia. In many ways, those very difficult behaviours that once upon a time were thought to be symptoms of the diseases are actually showing us the struggles of people who are trying to live their lives. A person sitting in a chair, possibly uncomfortable, logically stands up to walk away to get some relief, but because of their memory problems and their problems of thinking, will end up being labelled as a wanderer. But they're not wandering because of their disease, they're wandering because they wanted to leave the chair that they were sitting in that was so uncomfortable. Because if the chair had been comfortable, they would have remained sitting there even though they were dementing. So the wandering was not because of the disease, it was because that person living with that intellectual disability couldn't think it through and understand they'd get lost if they walked. They couldn't remember that in the past when they've done similar things, they've got lost. And also tragically, they couldn't tell anybody, I'm uncomfortable and I need to move. So all the carers see is the so-called wandering, which they should not see as symptoms of disease, but more as the evidence of struggle. And then the question is, how can we improve that person's life so they no longer struggle? give them a quality of life, and then we see so many of these distressed, disturbed behaviours fading away because they were so little to do with the disease, in other words, so little to do with the dementia, and far more to do with understanding the person and the quality of life that they're being provided with.